Hi, today I'm going to talk about what exercises might be helpful if you have cranky shoulders. I have two friends that unfortunately are awaiting shoulder surgery and they want to know what should they be doing in the meantime to improve their surgical outcome. My name is Roxanne and I'm a physical therapist with PT Health Academy. Please keep in mind that this video is for education and demonstration purposes only and should not replace the guidance of your primary care provider. Let's get started. First, I recommend that you work hard to keep your upper back or thoracic spine more mobile. This is because the good mechanics of your shoulder and the health of your rotator cuff is dependent on your upper back's ability to extend a bit as you elevate your arm overhead. We tend to be a little rounded, a little stiff, and then when you go to lift your arm, it has to work really hard to get up high. If I'm nice and flexible and extended through my thoracic spine, I get lots more freedom of motion. So how do you keep your upper back flexible and mobile? I've shown you before how to roll on a foam roller, but we're going to do a quick demonstration again. Rolling on a foam roller can be a really good way of getting your upper back to be a little less stiff and a little bit more mobile. It takes some consistency, but you'll see the nice gains. You're going to roll on the foam roller from the base of your neck, over the bump at the base of your neck, all the way down to the middle of your upper back. Please do not roll into your lower thoracic or low back area. That's actually really hard on that region. Now I'm going to show you 3 stretches you can do for your shoulder to help try to maintain your range of motion before surgery. You certainly don't want to lose any additional motion, and working on it, you might actually gain a little bit prior to surgery as well. The more motion you have going into surgery, the better off you are to gain that motion back after surgery. First, we work on elevation. Now with each of these stretches, you're going to start slow. You're going to do just a 5 or a 10-second hold, see how your shoulder tolerates it, and slowly increase to 30-second stretches that you can do 3 times. Again, the first one's elevation. You're going to find a nice flat spot to slide your hand up as far as it's comfortable going, and then you lean into it a little bit. Notice I'm keeping my belly button in. I don't want you to lean through your upper back to gain that extra, or your low back rather, to gain that extra motion. Keep your belly button in and then slide back down. Now, if you're stiff, it may just look like this, and you might have to step back to lean into it a little bit. Again, do what is comfortable. Don't grit your teeth and push through pain. You're just going to make it more angry, more inflamed. The second stretch is for rolling your arm out to the side, which is a very important direction to maintain. Research shows us that if we have at least 60 degrees of what we call external rotation, we really limit the impact or potential for developing arthritis in our shoulder. So hand is flat on the inside part of a door jamb or the corner of a wall. You're up nice and tall, elbows right underneath your shoulder, and then you turn your body until you feel that stretch. Now, unfortunately, what you're going to tend to do because your shoulder is tight is rotate your hips and leave your shoulders behind. So I want to caution you against that because that's hard on your low back. Make sure that your whole body turns. And if you're tight, you won't get very far, and that's okay. Again, 5 to 10 seconds, working up to 30 seconds 3 times each. And then the hardest one, the one that tends to be the most aggravating, you're going to bring your hand around your back as far as you're comfortable going, and then you're going to use your fingers to grip the edge of the door jamb. And then you want to try to sidestep so your hand is right in the middle of your bum. And that might be enough stretch for you because this can be really tight. If you still have room for some more motion, then go ahead and climb that door jamb. And you're basically trying to improve the ability to reach behind your back, which tends to be the tightest direction. So go easily. Again, your goal is not necessarily to gain a bunch of motion, but at least not lose any additional. My next recommendation is all about improving your upper back mobility, again, and strength. So any kind of rowing activity is usually fairly tolerated as long as you keep a couple of things in mind. Please don't let your elbows press way back behind you. You can see what that does to my shoulder. It puts a lot of stress off the structures in the front. So you really want to only row to this nice neutral position. Second, you want to make sure that your shoulder blades are pinching with every repetition. You want to make sure that you've got lots of mobility through those shoulder blades as you pinch with each rep. It's very easy, again, because we tend to be a little rounded and a little stiff, to only move through our shoulder joint. But I want you to make sure that you're pulling back through your shoulder blades. And you can do 3 sets of 10, just a regular strengthening reps. Finally, the last exercise that I would recommend to prepare your shoulder in the time prior to surgery is doing a little bit of a rotator cuff exercise. So keep it light, keep it short, because again, if you're going in for rotator cuff surgery, then likelihood is that you have a rotator cuff that's very angry. And so if you try to overwork it or do too much input, you're just going to make it more angry, more inflamed, which is not how you want to be going into surgery. Palms up, grab a TheraBand, prefer a lighter color, red or green, even yellow. Pull out just a little bit. Don't go full range, because again, you're going to bang into symptoms if you go too far. Again, 3 sets of 10 just for some general strengthening, and of course, focus on pinching those shoulder blades together with every repetition. I hope you found this video helpful. If you did, please like and subscribe. It really does help my small business grow. Thank you so much for listening.